Thank you for joining us for this edition of Georgia Grantmakers Alliance, Voices from the Field. I'm Bonnie Hardage, Executive Director of Jesse Parker Williams Foundation. Our foundation is focused on improving health outcomes and health equity for women and children in Metro Atlanta. I'm also a member of GGA's Public Policy Committee. Because Georgia Foundation's private resources pale in comparative size to the public purse, we believe that grants aligned with rational and equitable state policy can improve lives of Georgians. Over the course of the year, GGA's Public Policy Committee closely follows proposals and conversations among state policymakers related to health, mental health, education, child well-being, and the environment. As we study and evaluate policymakers' debates and decisions, we emphasize two through lines: racial equity and environmental sustainability. Our Voices from the Field interview series features nonprofit leaders reflecting on how specific state policies affect their capacity to serve Georgians. Today, I'm pleased to welcome Dr. Jean Sumner, Dean of the School of Medicine at Mercer University. Dr. Sumner, thank you for joining us today. To start us off, why do you believe foundations should be concerned with state policy?
I believe that state policy generally reflects need. I hope it's driven by citizens and their leaders to address needs in Georgia. And so foundations that support that often are the secret sauce that makes that policy possible, that gives the data, that shows the interest, that allows for the advocacy to shape policy so that it really has benefit. And so I think policy is very important, and being knowledgeable of policy, because I think that the legislature and those who create policy have the best interest in mind, but they need the input of Georgians to address that policy to true areas of need. Resources are limited, and our resources need to be directed to the areas of most need.
And generally, where is your work most affected by state policy?
Mercer University School of Medicine has been here for 40 years, and we exist for one reason. Our mission is rural and underserved populations. The citizens that we hope to serve live in populations that have been marginalized and have been underserved for many, many years. So policy is critical. A lot of money has been spent addressing rural Georgia, but yet our health status is still not where anyone would want it to be. Georgia this year during the pandemic has 6 counties that are reportedly in the top 20 of those with a percentage of deaths from COVID. They're all rural and they're all communities of color. And to me, that is not acceptable. Mercer is very focused on those populations and making a difference in rural Georgia.
So at present, Governor Kemp has recommended supporting an additional 188 primary care medical residency positions in Georgia, with a $2.6 million increase in the state budget for fiscal year 2022. This equates to approximately $14,000 per medical resident. If approved, how might this change impact the issues Mercer School of Medicine is working to address?
You know, we live in a country that focuses on specialized medicine, but in order to move the health status and the improved quality of life and the benefits that come from a healthy population, you must reestablish a strong primary care infrastructure. Physicians who are accessible, physicians who have continuity with their patients, physicians that have a broad range of knowledge to address problems that help individuals access the right specialty care. There's good data that shows that the stronger primary care is in an area, the better the outcomes and the less the cost. Many of our rural counties and even in urban populations do not have access to enough quality primary care. So I think that the secret to improving Georgia's health status is to build our primary care infrastructure, and I applaud the governor and the legislature for that effort.
And what, if anything, could Mercer's foundation funders do to better support your efforts to influence public policy in general?
I think understand that we're committed long-term to this mission. We have started on a series of clinics in rural communities that we have picked some of the most underserved areas of the state where others are not and others won't go. So our goal is to establish those clinics and to be there for the long haul, become part of the community, to be sustainable in those communities and to make a real difference. We joined the chamber, we participate in community events, we hire the highest quality physicians, nurse practitioners, PAs that we can. We have telehealth in every clinic, we bring in mental health services, and we have committed to women's health services in areas where there are not women's health services. We focus on the science behind rural health and addressing those issues. So understanding that the issues that face our state are complex and they're not going to be addressed or eradicated in a simple manner. It takes thought out policy. It takes support from a number of individuals and groups and organizations. And just being able to kickstart some of that work is really important to us.
Thank you, Dr. Sumner, for helping us better understand the impact these proposed budget and policy changes could have on provider shortages in Georgia. The need for primary care, as you've mentioned, and maternal health and mental health providers is increasingly creating significant barriers to healthcare access for Georgians. As our population grows, the gaps widen between metro and rural healthcare. Policy change is an important tool to improve Georgians' health care safety net and the well-being of Georgians. Thank you again. To keep informed on the current legislation session, look out for the next GGA policy update in the coming weeks. You can also visit GGA's programming schedule at secf.org/GGA. Thanks so much for joining us.